Good afternoon, Professor Fonseka and members who have gathered here. Let me welcome you to the fifth session of Wisdom U, where we are sharing important aspects based on practice and research insights. So today, we are privileged to have a resource person who is well versed in dental surgery. The topic today is on dental decay from saving to restoring. And we are privileged to listen to the insights and information of Professor Manil Fonseka, professor in restorative dentistry. To introduce him, may I invite Ms. Erandi Pereira and then to formally invite him to do the session.
Thank you, sir. It is an honor and privilege to introduce our distinguished speaker for this evening. He is Professor in Restorative Dentistry at the Department of Restorative Dentistry, Faculty of Dental Sciences, University of Peradeniya. He graduated with a Bachelor of Dental Surgery in 2004 with second-class honors and was awarded the Gold Medal for Excellence in Restorative Dentistry. He completed his Master of Science in Restorative Dentistry at the University of Colombo in 2009 and also holds the licentiate in dental surgery of the Royal College of Surgeons of England. He has served as the head of the Department of Restorative Dentistry from 2014 to 2021, and once again from 2024 to date, guiding innovation, training, and clinical excellence. Professor Fonseka contributes extensively to postgraduate education as an examiner for MD Restorative Dentistry and MD Orthodontics at the Postgraduate Institute of Medicine, and currently serves as the chairman of the Specialty Board in Restorative Dentistry at the PGIM. He has also provided exceptional leadership to the professional community, having served as past president of the College of Dental Surgeons of Sri Lanka, past president of the Sri Lanka Dental Association, and past president of the Peradeniya Dental Faculty Alumni Association. Today, we are honored to have him as the guest speaker for Wisdom Eve. Dear sir, we warmly invite you to the lectern to share your insights, experience, and knowledge with us.
Right. Thank you very much, Ranti, for a very elaborative description. And thank you very much for inviting me for this important occasion. I think it's a good opportunity and a good initiative where many of the different faculties can contribute and advance the knowledge and know-how on very important topics, right? And today I have selected dental decay because it is part of what I and quite a number of people in the audience practice on a daily basis. So we'll talk about dental decay. And of course, I will highlight how to save and how to prevent decay, as well as what we as dentists, dental surgeons, dental professionals can do to manage the disease, restore the teeth, and give confidence and good function to the patients. So, if we talk about teeth, which the dental faculty is infamous of, teeth are an important part of any person's appearance, right? You can imagine a person who doesn't have teeth, the moment the patient or the individual smiles, they don't look pleasing, right? And a lot of people nowadays are very concerned about to maintain the teeth, and not only to maintain the existing teeth, try to improve the natural appearance by various aesthetic mechanisms, right? So if you talk from an aesthetic or an appearance point of view, the most important role of the teeth is to define the smile, right? Uh, the face is not complete without a smile, right? But basically, the function of teeth is to bite, or what we call masticate, that is the scientific term, and also to help digest the food so that we get an efficient supply of energy, right? And the teeth play a big role in that, right? Simply putting it, the teeth tear and break the food so that you can eat smaller quantities. Without the teeth, it is not possible, right? Also, it helps to grind the food. And with grinding, what happens is it's broken into smaller pieces, where subsequently when you swallow it, the digestive juices and the enzymes can act more efficiently because it has a larger area. And also it mixes the food with saliva so that it helps swallowing easy and makes swallowing easy. And also there's a minor role of saliva in the digestive process. We look at dental caries, and this is the World Health Organization. The World Health Organization is the international organization who is responsible for determining health, preventing not only dental diseases, but also general diseases. And according to their findings and according to their research, 90% of the population worldwide has at least one decayed tooth, right? And that makes dental decay the most common disease affecting humans, right? Uh, Interestingly, now, if you take the medical literature, the commonest disease affecting humans, according to the medical scenario, is the common cold, right? But if you don't do anything, you catch a common cold today, you don't do anything about it, in 3 or 4 days, it will be healed, it will settle. But dental decay is not like that, right? If it initiates, if the proper environment is not created, it will continue and continue. And one day you will have pain. And then only a lot of people remember the dental school. Okay. So it is an important disease which everyone has to be concerned of, right? If you look at what I have circled here, this is the WHO figures for dental caries, right? I hope you can see that. And if you look at that, they have subcategories. They have looked at the caries uh, prevalence in 5-year-olds. That means how many 5-year-olds have caries, how many 12-year-olds, how many 15-year-olds, 35 to 44-year-olds, and 65 to 74. 65 to 74 is the elderly population. 5 and 12 are the children, and the rest of it is adults, right? And you can see in children, 65.5% have dental decay. Between 35 to 44-year-olds, which I think a majority of you belong to, 89.8%. That means 90% of the individuals have decay. And of course, the elderly population, 65 to 74 also, it's a very high prevalence or very high chance of you developing dental caries, right? And 690 million of children, that is, children is any individual less than 12 years old, 690 million of children worldwide are affected by decay of milk teeth. And the milk teeth are the deciduous teeth which come first, right? That equates to almost 80% of the children worldwide. Okay. So that is the extent of the disease. This is the Sri Lankan context. I was talking about the world context. Sri Lanka does what is known as a National Oral Health Survey every 10 years, right? And this is the last published National Oral Health Survey. You can see that among the Sri Lankan population, 35 to 44-year-olds, 92.5%, right? Almost 100%. And 65 to 74-year-olds, 98%. That means almost everyone has caries. Okay, so it is a very significant disease burden. All right. Of course, in children, the prevalence is quite low because there's a extensive preventive mechanism carried out among school children in the schools. So because of that, the caries experience among children is quite low. So what is dental caries? That is about the disease and where it is and how extensive it has spread. Dental caries is basically a disease of the dental hard tissue. If you see the tooth, that is the hard tissue you have. You have blood vessels and nerves in the center of the tooth, but the entire surface of the tooth is composed of hard tissue. It's something like bone, right? And what happens is, any calcified tissue, bone or teeth, right? I'm sure some of you are experienced with laboratory work, right? If you get a bone and put acid into it, the bone demineralizes. The calcium and phosphate removes, right? So similar scenario happens in your mouth where the teeth are exposed to acids produced by the oral bacteria or the bacteria which lives inside the mouth, right? I think you will understand how bacteria work. Bacteria basically, they don't eat vegetables, rice, curry, things like that. They take up micronutrients, and the main micronutrient bacteria takes up is sugars, sucrose, chini, right, glucose, lactose in milk. And all that they do is they have a metabolic pathway which is known as glycolysis, and the end product most of the time is lactic acid, right? And this lactic acid is the primary culprit involved in demineralization of the tooth. The outermost layer is enamel and the inner layer is dentine, right? So your mouth is full of sugars, right? When you eat your breakfast, your lunch, your dinner, your sweets, biscuits. When we come to the Senate, they give us tea, right? There's more sugar than tea there. So it is a constant process where the bacteria continue to make lactic acid, right? And bacteria is something which you cannot destroy in the mouth, right? The only way of destroying the bacteria in the mouth is you get the patient and put the patient in an autoclave, right? And then you can get rid of all the bacteria, but unless you cannot do that. So how do you see decay? The first evidence is you might note a slight discoloration on the tooth. It can be brownish, it can be yellowish, or sometimes it looks whiter than the normal tooth, right? And this is something, if you examine or every morning when you brush your teeth, after brushing your teeth, if you look at your teeth in the mirror, you will be able to identify it if you look carefully. So as soon as you see some change in the color, that is when you have to act. Not when it comes to this level, right? Then even if you act, we can't do anything, right? So the action should be at that level, right? Then as it progresses, you might end up with cavities, right? A lot of patients come and say, "Mage me date kuharayak tiyena." That is slightly late, right? So you come to that stage, right? And the moment you come to that stage, we have to, as dental surgeons, operate. We have to remove that decay and do some intervention measures. But if you identify your decay at this level, we don't have to do anything. We just have to do a few things, which I'll come to as we go on. We don't have to get an instrument, drill your teeth, cause pain, cause discomfort. We don't have to do that. We just have two very important measures and we can get that back to normal, right? And the further the decay happens, the enamel is lost due to the acids. The dentine, which is the inner portion of the hard tissue, is also lost. And then only you start to get pain and discomfort. Right? So the patients come and tell us, or you may come and tell us, "Mage data hiri වැටෙනවා." Then the other thing they come and tell us is, "ඊයර නිදාගන්න බැරි වුණා. හොඳටම කැක්කුමයි." That is very late. Then we have to do a lot of expensive, time-consuming treatment modalities to get you back to normal. So please try to look at your teeth at least every day when you get up, when you brush your teeth. Spend 10 seconds, 15 seconds looking at all your teeth and see whether you have these problems. If you have this problem, come and meet us. We will solve it very easily. Right? And when it comes to this level, the photograph right at the end, we cannot do anything to your teeth, so you will lose your teeth. Right? Of course, there are ways and means of replacing lost teeth that we can come to a bit later. But losing a tooth is, especially in the front region, in the anterior region, if patients lose teeth like that, they are not going to smile forever, right? Okay, so when someone comes, right, no teeth are going to be seen. Okay, right. These are the teeth at the back, the molars and the premolars. Again, you will have slight discolorations happening, right? Then we call this active caries lesion or active decay, where you can see, I told you there can be a change in color. Sometimes it becomes whiter than normal. That is an indication where there's a cavity underneath. Then, of course, you get the cavities, and then ultimately what happens is eventually the tooth breaks down. Okay. As restorative dentists, we discourage or tell people not to use sweets, not to use sugars, right? Okay. And remember now, out of the factors which we can use to prevent decay, controlling the sugar is the easiest thing we can do. We cannot control the bacteria, right? We cannot control the tooth because the tooth has formed, and after that we can't do anything. But what we can control is the amount of sugar we eat, right? So remember, this decay or acid production and demineralization is a dynamic process, right? In certain environments, the acid production is high and the decay is high. In certain situations, the acid production is low and the decay is low, right? So what we have to do as individuals is we have to try to shift this balance towards our favor, right? That means to prevent the acid formation and reduce the decay, right? So the unfavorable times, that means the times where the acid production is high, is during your meal times, right? Because there's enough and more food for the bacteria to digest. Even before you digest your food, the bacteria has digested, produced the acids, and dead and gone also, right? So remember, the times you eat are the critical times, right? And you should not include a lot of sweets, sugars in your diet, right? And the times which are favorable are during the times you don't eat, right? Then the bacteria doesn't have anything to metabolize or digest, and then the acid production is low. So that is what we have to try to do. I have put this pie chart. Only thing is, don't look at all the information. Please consider the 4 blue circles, right? Those are the most important factors. Other factors we can't control to a great extent. So caries or decay will occur only if the diet has the necessary ingredients. Of course, the teeth should be there. You have to have the bacteria. And of course, this acid has to act for some time, right? And the time factor also we can control to a certain extent, because now when you are demineralizing a thing, just because you put it to acid and take it out doesn't mean that it demineralizes. It needs time for that to happen, right? So the acidic environment should be there for a reasonable time. Now, if we can stop one of these 4 blue factors, decay doesn't occur. That's why I said the easiest thing we can stop is the sugars, right? By eating things like fruits, vegetables in their natural form, you will not get decay. Meats don't cause decay because they don't have fermentable carbohydrates like sucrose and things like that. What is dangerous is the chocolates, right? The cakes, the sugar you add to the tea, and desserts, things like that. Right. So in the diet, what we have to be careful is this part, which is the fermentable sugars. Fermentable sugars are, if you get it in a scientific context, it's sucrose, glucose, lactose, fructose. Those are the fermentable sugars. And out of them, sucrose is the main ingredient in sugar. So the more sugar you eat, the more calories you're going to get. Right? Then there are direct sugars and indirect sugars, right? Direct sugars means the sweets, things we eat. Indirect sugars means at the time of taking it into the mouth, it doesn't cause any decay, but in the mouth, it can be broken down into a level where it can initiate decay. And that is things like starch, right? Starch is palm piti, right? So any products, bakery products, you eat it, and what happens is the saliva in the mouth has an enzyme called amylase that can break down the starch into fermentable maltose and things like that. So they are called indirect sweets. So now sucrose, the moment you take it into the mouth, it can cause decay, but the others, it needs some time, right? So that is what I have said. Starch is minimally karyogenic, or flour is minimally karyogenic, but the salivary amylase can break it down into smaller parts, which are karyogenic. And importantly, fresh fruit, without adding the sugar, contains fructose. And fructose is very less karyogenic compared to the other sweets. So remember mangoes, bananas, pepper, they are sweet, but the sugar is not damaging, right? Okay, so therefore, even if you eat enough and more fresh fruit, you will not get decay, right? The moment, for example, if you make a fruit salad and add sugar into it, it becomes karyogenic. So don't add the sugar to the fruit. The simple example in the environment is, if you take monkeys, right, they eat enough and more fruit, right? But you will not find a single monkey with caries unless they eat your garbage and get sweets, right? They don't have decay because they eat naturally. Okay. So simple thing is you become like a monkey. Okay. Right. And also animals like dogs, cats, cows, they don't have decay. The only problem is domesticated. They can ගෙදර ඇති කරන බල්ලෝ පූසෝ සමහරලාට මේ අයිතිකාරයෝ සීනි ටිකක් අයිස්ක්‍රීම් දෙනවා, බිස්කට් දෙනවා. That is not good, right? Okay, so we can take the same example to humans. Eat natural things, don't add the sugar. The chance of decay is going to go down very drastically. Then, this is some scientific evidence. So, an individual named Stefan and Miller did a small experiment. Right? What they did was they dissolved some glucose in water and rinse the mouth with this glucose, right? So this acidity has a big role in decay, right? So the pH level, pH is a measurement of the acidity or alkalinity. The oral pH, the mouth pH at rest is about 6.5 to 7, very slightly acidic to neutral, right? And when they rinse the mouth with this glucose rinse, within 5 minutes, which is a very short time, the pH in the mouth dropped to less than 5.5. And if the pH drops below 5.5, that means if the mouth is acidic and the pH level is lower than 5.5, that is where decay initiates. If the pH drop is above 5.5, you're lucky, right? Because decay cannot initiate, right? So within 5 minutes, which is a short time, the bacteria have taken up all the sweets or the glucose, fermented and produced lactic acid within 5 minutes, right? And it takes another 15 minutes for it to come back to the normal, right? So within that time, the area there, within say within 2 to 3 minutes to about 12 minutes after the rinse, the mouth is very susceptible, or the teeth are very susceptible to decay. So remember, if you're snacking regularly, say in the morning you have a cup of tea with, we'll say 2 teaspoons of sugar, then you have breakfast, we'll say you have rice, then you eat a small biscuit at 10 o'clock, have a cup of tea at 10 o'clock, right? Lunchtime you have lunch, then eat ice cream. Then again 2:33 you have another cup of tea. You go home and have another cup of tea with sugar, right? Every time you eat, the pH is dropping, right? So if you restrict your sugars to maybe once a day, the time where the pH is below 5.5 is less. But if you snack 5, 6, 7, 8, 9 times a day, the pH drop every time you snack, it's going to go down, right? And I think you all have children also at home. It's a very important aspect for children as well, because milk teeth are very susceptible, or the chance of decay is very high. So even in children, we come across a lot of uh, children, parents, they come and tell us, so මේ ළමයි කන්නේ නෑනේ ඒක නිසා මේ බිස්කට් තමයි දෙන්නේ. I think schools, they have now stopped sending or stopped and they have told the parents not to send sugary snacks, right? They have made a plan for the children, but most of the time, naturally, children would like the sweets compared to the rice, curry, and other things, right? So if you start giving it, the problem is they're going to ask for it, right? So please don't start giving it, right? Okay, there are certain children who don't take sweets at all, and we don't see a single tooth decayed, right? So that is as good as what we can do. And then when you ask the parents, may කවුද මේ බිස්කට් ගේන්නේ? මේ අත්තම්මයි සීයයි, then the grandparents. නැත්තම් අම්මගෙන් ඇහුවොත් කියන්නේ මේ තාත්තා ගේනයි කියලා. So what we tell them is එහෙනම් තාත්තා ගෙනව නම් තාත්තා කන්න sweets ටික. Then they get the decay, right? So try to delay giving the sweets to children, right? If you can delay it till about 12 years, then the chance of decay is very less, because once the permanent teeth come and once they mature, the chance of decay is less. But if you start giving sweets at 1 or 2 years of age, they're not going to get the nutrients, right? They're only eating the biscuits and the chocolates and the cakes. Whereas the vitamins, the minerals, the proteins, which should come from the other food, they don't get it, right? And that is also a risk for diseases such as diabetes, diseases such as hypertension, right? We in Sri Lanka, now they have found that young people are getting diabetic, hypertensive, high cholesterol. So all that can be prevented if you delay the introduction of sweets. So it's not only for dental decay, it's valid for all the other medical problems as well. This I put just for interest, right? These were historic studies done in the pre-war era, the World War II era. So Whiphome study was done in a hospital in Sweden. Sweden is a European country. This study was done, Whiphome study was done in a hospital called Lund Mental Hospital, right? And mental hospitals is basically like Angoda in Sri Lanka, right? So you have a lot of patients who have psychological or psychiatric disorders, right? They are not normal in terms of their intellectual skills, right? So this is a very cruel study. Mind you, in 1945, during the World War II, sugar was in very short supply, so they couldn't get sugar, right? And because of that, all the patients in this hospital were not given any sugar at all, right? 5 years later or 10 years later, they looked at the teeth and they found that there's no decay because they have not been using sugar, right? A similar study was done in Australia, New South Wales. It's called a Hopewood House study. Hopewood House was a orphanage where they had children, right? Again, very cruel thing. Again, during the war or immediately after the war, half of the children were not given sugar at all. The others were force-fed sugar, right? Not the normal quantity, excess quantities, right? Right. So currently, you will not get any ethical clearance to do studies like this, but they have given very good evidence to say that sugar has a very big role in decay, right? So the children who got enough and more sweets or more than what is necessary developed a lot of decay, whereas the children who were not given sweets at all had very minimal decay, right? So that is how we have come to the conclusion that by controlling the sweets, we can reduce the decay, right? So it's a very simple disease to prevent. Okay. Now, a lot of the people in Sri Lanka are used to taking various snacks, right? So fizzy drinks, right? Coca-Colas, Sprite, they have a lot of sugar, and currently all beverages in Sri Lanka are marked, right? So they have a red mark if they have high sugar. They have a green one if they don't have any sugar at all. And they have yellow and orange, right? So these are very high sugary things. Orange juice, right? Provided you don't put the sugar into the orange juice, it is fine, right? But the moment you add the sugar, it becomes very, very acidic, very carcinogenic, because orange juice is also acidic. Plus, the sugar makes more acid due to the bacteria, right? Milk. This is very critical, right? In young individuals, neonates, infants, they exclusively depend on milk, right? So until 6 months, according to the Sri Lankan guidelines by the College of Pediatricians and all the other medical advice, the children have to be exclusively breastfed, right? But the thing there is, at 6 months, there are no teeth in the mouth, right? So drinking milk is not a problem. The moment the teeth come in, at 6 months, they tell the parents to shift into semi-solids. That means rice, vegetables, but in a semi-solid state. And now the milk should slowly reduce, right? And by the age of 12, breast milk doesn't provide any adequate nutrition to a growing child, right? So giving breast milk is just for comfort and the connection between the mother and the child, right? So they have to be slowly weaned out or reduce the consumption of milk continuously until they go out of milk, right? And the more dangerous thing is putting formula milk, right? So at the moment children get into formula milk, the decay is very rapid because that is an artificially constituted thing and there's a lot of sweets in it, right? And the worst thing is feeding at night time, right? So you might be having young children at homes. Don't give milk at night when they fall asleep, right? Because when they fall asleep, the milk is still in the mouth and the decay at night time is very rapid, right? Because the bacteria is inside, there's no protective measures. The saliva in the mouth is very limited. So the bacteria has a party in the mouth, right? So please avoid milk at night. Then there are protective foods also, things which are good, right? Yogurt, although it is acidic, again, provided the amount of sugar is in the yogurt is less, it doesn't cause much caries because yogurt has high amounts of calcium and it helps put the calcium back into the tooth, right? The bacteria produce acid and remove the calcium. The yogurts can put the calcium back. Peanuts, not carcinogenic at all. Cheese, same thing, very high amounts of calcium, so it's protective. And fruits are less karyogenic if eaten whole. That means if you take a banana and eat it, no problem. Take a pepper, eat it, mango, guava, whatever fruit is fine. Don't put sugar for it to taste better. Okay. Then a bit of scientific knowledge. Bacteria is the main cause of this dental decay. So most of the common bacteria in the oral cavity are Streptococcus mutans, Sorbinus and other species, and Lactobacillus. They are the two primary types of bacteria which cause caries, right? Now, I'm sure you have come across individuals, right? So someone might come and say, මම පැනිරහ පොඩ්ඩක්වත් කන්නේ නෑ ඒ වුණාට දත් ගොඩාක් දිරනවා. හරි. අපේ අයියා පැනිරහ හොඳටම කනවා. එක දතක්වත් දිරලා නෑ. Right? You would have come across ඒ වගේ කට්ටිය ඉන්නවා. හරිද? සමහර කට්ටිය කොච්චර පැනිරහ කෑවත් දිරන්නේ නෑ. සමහර කට්ටිය පොඩ්ඩ කෑවත් දිරනවා. හරිද? That is because the types of bacteria in the mouth are different. Right? The bacteria in Eranti's mouth and Damayanti's mouth and Champika's mouth is different, right? So if you have the good bacteria, whatever you eat doesn't have an effect, right? But if you have the bad bacteria, slightest amount of sugar, it's a problem. So you have to figure out what is happening in your mouth. Okay? Then some of the protective bacteria are the bacteria which sometimes don't form acid, right? So if we can't modify that. That depends upon our defenses in the mouth, the types of bacteria in the mouth. We have no control of that, right? We can't go and buy protective bacteria and put it in the mouth. It doesn't work, right? Because it is an ecosystem. ඒ කියන්නේ ecosystem එකක් කියන්නේ driver. So just because you put good bacteria doesn't mean the bacteria will stay in the mouth, right? Because other bacteria dominate. Okay. So dental bacteria has a big role, right? Then the tooth, right? If your teeth have formed normally, it has natural protective mechanisms against decay. So enamel, the outermost layer of the tooth, is the hardest. If an individual doesn't have teeth, there is no necessity to be careful with sugars, because if you don't have teeth, it doesn't decay, right? Only thing is you have to be careful about your general health, right? Again, the amount of calcification of your teeth can vary from individual to individual. There are some genetic diseases which cause poor calcification of teeth. I'm not going to talk about that too much because it's very rare, right? But individuals can have differences in amount of calcification. So the more the teeth are calcified, the less the decay is, right? The enamel, the outermost layer of the tooth, has an ability to remineralize. That means with acid, it removes the calcium hydroxyapatite. If the environment is right, the calcium hydroxide can come back, calcium hydroxyapatite can come back and solidify on the tooth. So your outer layer of the tooth has good protective mechanisms. It can get back to normal. But once it pierces the enamel and gets into dentine, then we cannot reverse it. It will continue. Then the time, it's a very important factor. You need time to convert the substrate to the karyogenic form, right? So therefore, if you can eat quickly, right? But that is not recommended also, because if you eat quickly, you don't munch and masticate and break the food down. The time the sugar is in the mouth is less, right? So if you're drinking sweetened beverages, what is recommended is to use a straw and drink it, right? If you drink it with a glass, you spread the sugar everywhere in the mouth. Whereas if you take it with a straw, it goes onto the tongue and straight into the oropharynx, right? Okay. So that means you don't put it and spread it in your mouth, right? So that is a recommendation. If you really want to drink sweetened beverages, use a straw and drink it rather than taking it in a glass and sipping it. Okay. But the best thing is not to take it, right? Okay. And if you snack very frequently, the chance of decay is high, right? So don't snack frequently. And if you want to snack frequently, use natural things like nuts, fruit, and things like that, rather than cakes and biscuits and chocolates. Right? So that is how you show that. So the more snacks you take, the more meals you take, the amount of pH drop is more frequent. Then the last but the most important factor humans or any animal has is the saliva. That means the fluid inside your mouth, right? So saliva has a big role, right? It protects teeth against caries. It flushes out and dilutes the sugars, right? It can dilute the acids which is produced, right? And saliva has mechanisms to destroy bacteria, which is known as antimicrobial. It has something called IgA, which can destroy or prevent the bacteria from proliferating, right? And the most important factor in saliva is what is known as buffering, right? Buffering means when you put an acid, it neutralizes. If there's a base, it neutralizes as well. It tries to maintain the pH at a constant, right? So saliva has a lot of capacity to buffer, and also it has a lot of calcium and phosphate to help the teeth mineralize, right? Again, there is variation. Some people have good saliva, some people have bad saliva, some people have no saliva, right? Certain diseases affects the salivary glands, and there is no saliva at all, right? And if there is no saliva, you will find that within months, you will find that all the teeth decay. And the quality of the saliva is important. It should have enough buffering capacity. It should have enough antimicrobial properties, and it should have enough calcium, right? And again, that also depends on the individual, unfortunately, right? Everyone's saliva is not the same. It doesn't have the same amount of buffering. It doesn't have the same amount of calcium, nor does it have the same amount of antibacterial activity, right? So people who have a lot of decay, the problems can be that the saliva quality is not good. They don't eat, they eat a lot of sweets, and also the bacteria might be bad. So there are different buffer systems. I don't think I'll spend a lot of time there. Now, currently, now I was talking about sugar, sucrose, but there are things called artificial sweeteners, right? Sorbitol, xylitol, aspartame, saccharin. Those are artificial sweeteners. They are sweet because they have artificial chemical material in it, which when you taste it, it tastes sweet, right? But they cannot cause decay. Okay, so people who are on artificial sweetness, sometimes diabetic patients might be on artificial sweetness, they have less evidence of caries. But the thing is, these artificial sweeteners are all chemicals, right? So you should not be loading your body with chemicals also, because that can have, maybe caries will go down, but somewhere along the line, you may develop a carcinoma or something like that because of the chemicals, right? So that's why, although we have alternatives, it is best to avoid the sugar. Okay. Then the other friend in terms of protecting caries or protecting against decay is fluorides, right? You will see when you buy a toothpaste, right? They will always say if there's fluorides, it has fluoride containing toothpaste, right? And fluorides have a very important role in preventing caries because fluorides interfere with the bacterial metabolism and prevent bacterial growth. It also fluoroapatite, which deposits on teeth, are more resistant to acid demineralization than the calcium hydroxyapatite on teeth. So the amount of decay is less, and it promotes remineralization. So fluoride is an absolutely necessary ingredient to be having in your toothpaste, right? Now, a lot of companies market herbal toothpastes, right? Herbal toothpastes don't contain fluoride, right? And you can't put fluoride into a herbal toothpaste also because the organic composition is such that the fluoride ion doesn't stay as a fluoride ion when you add it to it, right? So even if you add fluoride into herbal toothpaste, it doesn't give the effect, right? And we have seen people who are using herbal toothpaste, the amount of decay is very high because fluoride is not there, right? On the other hand, herbal toothpaste prevent gum disease, right? That is a known fact, right? So if a patient has gum disease or Vidurumas roga, which we call in Sinhalese, the herbal toothpaste will help. But they are two different diseases, right? එතකොට මේ දියවැඩියාවට ගන්න බෙහෙත ප්‍රෙෂර් එකට මේ වැඩ කරන්නේ නැහැ. හරිද? So that's why there are two different diseases and the treatment for the different diseases are different. So just because you take the herbal toothpaste in an effort to prevent decay, it is not going to happen, but it will certainly prevent gum disease. If we find people who are more prone or at a higher risk or that දිරන්න තියෙන හැකියාව වැඩි කට්ටිය නැත්තම් මේ high risk individuals, we can do what is known as sealing up of teeth. We call it fissure sealants. So decay mostly happens on the biting surfaces of the teeth. So if you seal the biting surface up with these fissure sealants, the chance of decay is less. So all children, we recommend that when the first permanent teeth come out, go for fissure sealants if they have decay in the milk teeth. But if they don't have decay in the milk teeth, maybe their protective mechanisms are good, so it is not absolutely necessary. But in a child, if a single milk tooth is decayed, as soon as the permanent teeth come up, you have to do fissure sealants. It can be done. It's a very simple process. You just have to apply that on the teeth, and there's a special device to make it solid. It is a very simple process, and that can protect your teeth against decay. Of course, the fissure sealant will wear off with time, but by that time, the teeth are mature enough to resist caries on their own, resist decay on their own. Then they have tried a lot of things to reduce the amount of bacteria in the mouth, right? So you can use mouthwashes, you can use different chemical agents to reduce the amount of bacteria. But the problem is, even if you reduce the bacteria, you can't remove it 100%. So in a matter of 20 to 30 minutes, the bacteria is back in the mouth, right? Because it reproduces very rapidly, right? So using antibacterial agents is not recommended because it doesn't work as effectively as we think. Right. Just a few things about what we can do. So I told you once there's a cavity, we have to treat it. So what we do is we remove the soft tissue on the tooth and do a restoration, right? So this is the slide on the right side of you is after it is restored. You can see that all the decayed tissue is removed and we can get it back to normal. So it looks almost back to normal, right? There is no difference between what we had before decay and what we had after, right? Then with extensive decay and extensive breakdown, we cannot directly repair that, right? We need to use porcelains and various crowns, bridges. Those are devices used in dentistry to restore and get the appearance and the shape and form back to normal. Because once the tooth is broken to that level, we cannot repair it directly, right? There is not enough tooth left to hold the filling or the restoration in place, right? So we need to fabricate it outside and fix it or glue it onto the tooth, right? With extensive decay, the next problem comes when you have pain, right? When a patient has pain, that means the center of the tooth has what is known as the pulp, which is the blood vessels and the nerves. And when the bacteria enter the interior tissue, it causes very severe pain, right? And in such situations, what we have to do is we have to do what is known as root canal treatment, or people call it nerve fillings, right? So you can see here that there's a lot of decay, there's infection, and this photograph shows an abscess forming. So once we do root canal therapy, the infection stops, the pain goes away, the abscesses settle, and then the patients can function normally. But remember, the tooth is dead because all the nerves and the blood vessels and the cells are removed, right? So it is like a mummy in Egypt, right? The face is there, the body is there, but dead, right? Okay. So the objective is not to keep a dead tooth, to keep the tooth live. And to keep the tooth live, you have to identify decay early and treat early, right? And if the teeth are lost, now here the tooth is broken down to a very bad extent, we can have very advanced treatment modalities. This is called an implant. It is made out of titanium and it is surgically placed in the bone. And later on, once it heals, we can fix a tooth onto that. So we can get back to normal, right? But that is a very expensive, a time consuming process, right? Because these devices are made out of titanium and they're very expensive, right? So it's costly, right? And in the Sri Lankan health system, they are not going to give it free of charge to anyone, right? Okay. So what you have to do is save your teeth, right? And to save your teeth, what we do is control the sweets and use the fluorides. And thirdly, every day have a look at your teeth, and the moment you identify some slight discoloration, seek advice. Then we can tell you to change the diet. We have what is known as fluoride applications. We can apply it on your teeth and the decay will stop. But once there's a hole or a cavity or a kuhare, then those measures are not going to work. We have to surgically do something. Have we run out of time? Okay. I thought we should talk about this as well because this is not about decay, but this is something equally important in Sri Lanka, which is known as non-carious tooth substance loss or tooth wear, right? And you will see it quite often, right? So this problem affects not the young people, but the older people, right? And Sri Lanka, right? If you look at the population of Sri Lanka, this is the population, what is known as a population pyramid. And this is in 2016. You can see the bottom part, 0 to 4, 5 to 9, 10 to 12, they are the younger group, right? The older group is here, 65 and above. That is small, okay? This is 2030, right? This is 5 years from now. You can see that the younger group is getting smaller and the older group is getting bigger, right? If the rate of the population growth continues like this, 2050, you will see that there are more elderly than young, right? And by 2050, I will also be there, right? That is 25 years from now, okay? So the problem of tooth wear, non-carious tooth substance loss, is the elderly population, and Sri Lanka is an aging population. So I'm sure a lot of you will also age, and then you have to be careful about these aspects as well, right? 2100, if it goes like this, there won't be very many young people, right? All the people will be elderly. I will be gone, right? But some of you might be there, right? So they will be somewhere here, okay? Right. Now, the problem with the elderly is that there are a lot of medical problems, right? And they take various medication, and a lot of them have gastritis, right? Now, the gastric acid or the stomach acid has a very low pH, right? It's like decay, but it is not caused by the bacterial acids, right? It is caused by acids in the stomach, right? With gastritis, you find that the stomach acid comes to the mouth. And when it comes to the mouth, it can demineralize or dissolve the teeth, right? Stress is another problem, right? Lot of our younger generation and middle-aged people are in stress, right? What is the problem in stress for the teeth? Stress නිසා දත්වලට මොකද වෙන්නේ? Hmm? Sorry? yeah, they don't have time to maintain hygiene because they have to think about all the other things, right? And one way of getting rid of stress is what happens on the roads, right? They scold, they fight. That is ways of releasing stress, right? The other way of releasing stress is you start grinding your teeth. Dath miti kana එක, right? Part of it is due to what is known as internalizing stress, right? People who bite nails, bite, right? Then grind teeth. That is part of releasing stress, right? Teeth are made only to bite, right? Not to bite the nails and not to bite this for half an hour, 45 minutes, not to bite pens and not to grind, right? They have shown that if you eat only, right, the number of minutes per day where the teeth come into contact is only 7 minutes out of 24 hours, right? So 24 hours of the day, the teeth come into contact only 7 minutes of the 24 hours, right? Now at this point, none of your teeth are in contact. That's වැදිලාද තියෙන එකකින්ට. නෑනේ. කනකොට විතරයි දත් වදින්නේ. ඒ කන වෙලාව දවසට විනාඩි 7යි. The time you come into contact, right? But if you're grinding your teeth, right, you increase the time of contact on teeth to about 5 hours per day, right? That is 300 minutes, right? Not 7 minutes, right? So it's like this. Mama make a මෙහෙම අතුල්ලා හිටියොත් දවසම මේක ගෙවෙනවා, right? Same thing happens to the teeth. If you're grinding, the teeth wears off, right? So what will happen is you end up like that, right? That is not dental decay, right? That is called attrition, right? And the older you grow, the more you lose, right? Because although you come into contact only 7 minutes, that multiplied by the number of days and the number of years, the contact is more, right? So old individuals will have this problem, right? And also what happens is when you grow old, you lose a few teeth. The rest of the teeth have to take all the load, right? And if people are grinding teeth, it wears off very fast, right? At the age of about 35, 40, you can get this appearance, right? This is the appearance of a 70-year-old, right? Then the second problem, right? Excessive brushing of teeth, right? Okay, so what we recommend is brush so that you rotate the wrist downwards. Don't brush like this, okay? When you brush like that, all the big muscles in your arm is applying pressure on the teeth, right? It's like taking a saw, නැත්නම් කියතක් අරගෙන you do it continuously, what will happen is the teeth will wear off. And the place which wears off is where the tooth meets the gum, because that is where you apply the most amount of pressure. So if you rotate your brushing, the chance of wearing is less. The third thing is erosion. That is because of the gastritis, right? So the gastric acid comes out, it demineralizes or removes the enamel, and it ends up as erosion. And also, children who drink fizzy drinks, the amount of erosion is more because that is also acidic. And that is not because of dental decay by the bacteria, it is by acids we consume, right? So things like lime juice, fizzy drinks are a problem, right? And a lot of the younger individuals consume a lot of this, so you have to be careful. So in that aspect, tea and coffee and water is better, right? So I think that's about it. So I just took this quote from, this is today's quote, right? So don't judge each day by what you have achieved, but rather what you have planted. So I hope I have put some information into you so that you can think about it. You will carry it to your homes, your families, your children, your parents, and also the people who you work with, right? And we are happy to see you regarding dental decay. If anyone in the university is more than free to come, right? Please let us know before you come, because we also run busy clinics, but otherwise we are happy to see you, right? So thank you very much. And if there are any questions, I'm happy to answer.
Doctor, I have three questions.
Yes.
One is our grandparents, they have used a chewing beetle. So we know that the dentist not recommending chewing beetle, but our grandparents, they are telling they have using spices, cloves and cardamoms. Therefore, they can maintain the good oral health. What's the background of that?
So why, as dental surgeons and as dentists and as the dental school, any dental professional will tell you not to use beetle is because of the risk of cancer, right? That has nothing to do with dental decay, but erica nut and tobacco used in beetle is a big risk factor for developing oral cancer, right? The answer to the second part of your question, which they say they don't have decay, is due to the fact that your grandparents would have consumed a lot of natural things, right? Their food may be homegrown, right? The rice is cultivated in their farmlands, right? Spices have no potential for decay as well, right? You use enough and more spices, it doesn't cause decay, right? But what they haven't used is all the biscuits and the chocolates and the confectionery. It was not available maybe at their age, right? But now only with development, with industrialization, with international movements, only these bad factors have come, right? So if you look at the natural Sri Lankan diet, right? It is not it doesn't cause decay at all, right? And the fact of the teeth being hard and solid is the fact that with beetle chewing, I am not recommending beetle chewing, right? They masticate and bite a lot, right?
Mm.
The teeth are held in the jaw by certain fibers, right? And the more you use it, the more solid it gets, right? So that is why their teeth, they say it is strong, and the amount of decay is less is because of the diet.
Okay. So the other question is, how about having jaggery and kithul, tickle and other things instead of sugar?
Again, the problem is in the manufacturing process, right? If you can make your jaggery and your treacle very naturally without adding sugar, right? All the commercial treacles and jaggery have sugar added to it, right? So even jaggery and treacle is karyogenic because it has sucrose naturally added. But if it is made in a pure process without adding artificial sugar, it is less it will cause less decay than the ones with added sugar.
Okay. The last one is there is a plant called stevia.
Mm-hmm.
That is, we have heard that that is 300 times stronger than sugar, sweeter than sugar.
Mm-hmm.
So why can't we use popularize that kind of plants and we can move?
So we have to always look at what say the particular plant, what causes the sweetness we have to look at. So if there is a lot of fructose, glucose, sucrose in it, now sugarcane has a lot of sucrose in it, right? So it may be sweet, but it will all depend. It's very unlikely that it will have an artificial sweetener in it, right? So it's a natural plant.
Yeah.
I can't give you a direct answer to that unless we look at what is the active ingredient which causes the sweetness.
The persons who are cultivating that, they are telling that that is only the sweetness, sweet flavor is there, but nothing is there.
Okay. So if there is no sucrose, if there is no fructose, then it cannot cause decay. Right? But I can't tell you a proper answer to that unless I look at what.
But
So I will
even in the internet, I searched for that because my interest.
Yeah.
It is telling that actually that is 300 times sweeter than the sugar. We'll see about that.
Okay.
Thank you.
younger children,
Yeah.
during the season or something, why can't we propose it to government to have it under that school dental clinics? Or
Yeah. So, 2024, the community dentists college, they have proposed that to do fissure sealing for all children at the age of 6. Only thing is, doing it is not, because you can't get all the children to a clinic and do it. You have to go to the school and do it, because the parents might not be able to bring all the children to the clinic. So for that, you need to do a lot of community work. That means you have to go out and do it, right? So they are working on that, fluoride varnishes and fissure sealants, right? Fluoride varnishes, giving fluoride varnishes to what we call high risk groups. That means children who have high chances of getting decay, you give fluoride varnishes. Now, for a child who doesn't have decay, there's no real point in giving it, because there is no added benefit, right? Whereas if a child has a risk of getting it, then of course, so fluoride varnish is recommended for high risk groups. But to identify the high risk groups, you have to go to the schools and find and examine and see who are the high risk people. But fissure sealants, they're going to probably in 2-3 years' time, they will make it mandatory that all children get fissure sealants on the first permanent molars when they come at the age of 6. Yeah, so if you wash your mouth, then what you do is you basically dilute the sugar in the mouth, right? So there is a scientific effect of that. So if you eat and immediately vigorously wash your mouth, you will dilute the acid, one, and you will wash off the excess sweets on your teeth. So it can be effective, but can you do that always is the question. Okay, so if it can be done, but that is not a substitute of reducing the sugar and reducing the amount of sweets, right? මේ ලංකාවේද ෆ්ලෝරයිඩ් අඩංගු ටූත්පේස්ට් වර්ග 4ක් හෝ 5ක් තියෙනවා මේ ඒ කියන්නේ ලංකාවේ මැනුෆැක්චර් කරලා විකුණන. ඒතකොට දැනට තියෙන්නේ සිග්නල්, ක්ලෝගාඩ් තියෙනවා, ක්ලෝස් අප් තියෙනවා, කොල්ගේට් ඉම්පෝර්ටඩ් මේකක් ඒ වුණාට ලංකාවේ available. ඒ හතර තමයි සාමාන්‍යයෙන් ෆ්ලෝරයිඩ් තියෙන ඒවට තියෙන්නේ. ෆ්ලෝරයිඩ් නැති ඒවට තියෙන්නේ ඔක්කොම මේ ආයුෂ් කියලා එකක් තියෙනවා, මේ සිද්ධාලේපකින් මැනුෆැක්චර් කරන එක, සුදන්ත, ඒ ඔක්කොම ෆ්ලෝරයිඩ් නැති ගොඩට වැටෙන්නේ. ඒකේ යම්කිසි මේ ගුණයක් තියෙනවා. ඒ වුණාට විදුරු මස් රෝගවලට තමයි ඒක වඩාත්ම effective. ඒ කියන්නේ ඒ herbal toothpaste නැත්නම් මේ ඔව් කියන්නේ ආයුර්වේද preparations වල effect එක තියෙන්නේ මේ විදුරු මස් රෝගවලට. ඒව සෑහෙන අඩු වෙනවා. හැබැයි දත් දිරන එකට effect එක නැහැ ඒකේ. එතකොට අපි බලන්න ඕන තියෙන්නේ මොන රෝගයේද කියලා. ඒ අනුව අපිට මේව කරන්න පුළුවන්. ඒ වුණාට දැන් ගොඩක් කට්ටිය ওই දත් දිරපු නැති කට්ටිය මේ හර්බල් ඒ කියන්නේ ওই ආයුර්වේද ටූත්පේස්ට් වලට ගිහිල්ලා අවුරුදු 3-4කින් එනවා ඒගොල්ලොන්ගේ දත් දිරලා. එතකොට අර ෆ්ලෝරයිඩ් වල තිබිච්ච ගුණය නැති වෙලා තියෙනවා.
Now, since we discussed about this toothpaste, this Sensodyne,
Yeah.
it says it reduces the pain.
Yeah, Sensodyne is a different type of toothpaste. Now, what happens is, again, with aging, the gum of the teeth recede or go down and the root of the tooth is exposed, right? When the root of the tooth is exposed, what happens is when you take something cold, when you take something hot, the root is very sensitive, right? Now, Sensodyne has an effect of reducing that, but it doesn't reduce decay. That is, so Sensodyne, and there are what are known as desensitizing toothpastes. They are recommended for people who have sensitive teeth, not due to decay. Say, if the roots are exposed, then we can give it for a short period of time, maybe about a month. Once you use it for about a month, the sensitivity goes off, then you have to get back to your normal toothpaste. So it should not be used as a daily application or daily dentifrice.
And you mentioned that having traditional food
Yes.
reduces decay. Can you elaborate on what are those traditional?
So traditional foods are, now if you look at the Sri Lankan, the ancient Sri Lankan diet, it is of rices, pulses, meats and vegetables, right? So none of them are caries causing, right? If you take rice, the newer rice varieties might be cariogenic because they're highly polished and clean, but the older rices, the traditional rices are considered non-cariogenic, right? Vegetables don't cause any decay at all. The fast food and the confectionery are the problem. Right?
And the thing is, now we brush tooth only 2 times a day. Morning after the meal, night after the meal. So, but we don't have an arrangement to brush after lunch. Good if we can do, but so
See, that has the reason for that is firstly, brushing 3 or 4 times a day is not practical. So, if we tell people to brush 3 or 4 times a day, especially working individuals, school going children, it is not practical, right? Now, once you brush your teeth, this to cause decay, it doesn't. So, once you brush your teeth, certain amount of bacteria is lost or destroyed, right? For the bacteria to come back to the normal levels, it will take about 8 to 10 hours. Right? So that is the justification for brushing twice a day. Right. So basically, if you can reduce the bacterial count regularly, the chance of decay is going to be less. And fluoride, once it's applied in the mouth, it is effective for about 2 hours. Right. So doing repeated things, if you can do it, is fine. But in most situations, it's not practical.
and if we drink tea,
Yeah.
I mean not with milk.
Yes, plain tea.
Yeah, plain tea also now you can have some little bit of sweet thing, not to put to that, because what I have heard is that tea has this medicinal value.
Tea has high amounts of fluorides in addition to the medicinal value. So if you're drinking plain tea without sugar, without milk, it is caries protective. Only issue is plain tea can stain your teeth. That is a minor matter which we can clean up. But the amount of decay is going to be less provided it is plain tea without sugar. And green tea is fine as well.
What about chewing gum?
Chewing gum, the more you chew, the more saliva you get in the mouth. So I told you earlier that saliva has all the protective mechanism. Chewing gum is fine provided you keep on chewing it for some time, because what happens is once the sweetness goes, people tend to remove the chewing gum. So if you're biting it for a long period of time, it itself can be protective, because every time you bite, there's saliva recirculation, and that will protect the teeth.
Thank you.
Okay.
Doctor, another one, a small one, regarding the brushing of tooth. Then early in the morning, at what time you recommend, after the breakfast or just after the bed?
Recommendation is after breakfast, because if you brush before breakfast and you eat the breakfast, the fluorides are also washed off from the mouth. So, and also the food particles will remain in the mouth. If you brush after your meal, the brushing itself can get rid of a lot of food particles, and once you put the fluoride in, it will stay in the mouth for some time. Okay. So recommendation according to guidelines is that you brush after breakfast and at night just before you go to sleep. And once you brush, you should not take any food into your mouth. Okay. Yeah. Hmm? Line on the tube of the toothpaste. The color coding and that it depends on the active ingredient of fluoride, right? So there are two types of fluorides added to toothpaste. One is called sodium fluoride, and the other one is sodium monofluorophosphate. So depending on which you have in the toothpaste, the color code will be different.
You have shared with us a lot of valuable advices and information. What is the take-home message you would like to emphasize to us?
So the take-home message is now this dental decay is a very, very common thing. I think I put enough and more statistics to show that 90% of individuals have at least one decayed tooth. I'm sure if we look at all of you all, some of you all would have had fillings on teeth, some of you would have lost teeth due to decay, right? But at the same time, decay is one of the easiest things to prevent, right? So if we can see more prevention, it means less work for us, right? And of course, saving your natural tooth is what you have to do, right? Replacing it with an artificial material is not the best. It's the second best option, right? So my message is try to prevent decay, change the diets which will benefit not only decay but all the other metabolic diseases people have, right? Obesity, hypertension, diabetes mellitus, cardiovascular disease, all of that, the amount of sweets and fermentable carbohydrates you take is less. It affects those diseases. So if we can cut that down, it will help your oral health as well as your general health. And the use of fluoride. So those two in combination can prevent about 90% of the decay. Now, the Western population, say the developed countries, children are using less and less and less of sweets, right? They are into more organic food, natural food. So in time to come, of course, the effect will take 10, 15 years to manifest, but they will definitely have less decay. And the figures are showing it, because if you look at the figures of a developed country, the amount of decay is higher. Children, it's hardly evident. So that is my take home message. And then the other thing is the elderly group. So naturally, everyone will grow old. Think about what will happen to your teeth. So don't lead a stressful life. Right? Try to have stress controlling measures. I mean, work itself is stressful, right? Try to manage that.
So we are very thankful to Professor Manil Fonseka from Faculty of Dental Sciences, University of Peradeniya, for sharing us this valuable insights on dental decay. And on behalf of the Human Resource Development Unit of University of Peradeniya, we are very thankful of you for sharing these valuable insights. Thank you.
Thank you. It's a pleasure, actually.